Good morning, everybody. Welcome to Calgary's Mental Health and Addiction Strategy, a Community of Connections Town Hall. My name is Paul Arnold. I'm Director of the Mathison Centre for Mental Health Research and Education, and I will be your moderator today. Next slide, please. So before we start our program, we would like to take the opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta, Region 3. Next slide, please. Please note that this webinar is being recorded. The recording will be shared afterwards. It will be on the O'Brien Institute website. During the event, you can use the Q&A chat box to ask questions. If you have any questions or concerns after the event, you can see the email up there. So please contact the O'Brien Institute at iph@ucalgary.ca. Next slide, please. So before I introduce our panelists, I'd just first of all like to say I'm very excited to present this Mathison Centre for Mental Health Research and Education and O'Brien Institute for Public Health Collaborative Town Hall. And just to set the stage, today's town hall will introduce the City of Calgary's landmark mental health and addiction strategy to the University of Calgary community and highlight areas of relevance, particularly for research, but also for campus wellness, so areas that are particularly pertinent to our university community. And so I'd like to begin now by introducing our distinguished speakers and panelists. And so first of all, it is my great pleasure to introduce the Honorable Mayor Naheed Nenshi as one of our panel speakers. As you all know, Mayor Nenshi is nearing the end of his third and final term, or recently announced that this will be his final term as Mayor of Calgary. And during that time, he's made immense contributions to our city, has received numerous distinctions, both before becoming mayor, and relevant today is a recipient of the Humanitarian Award from the Canadian Psychological Association for his contributions to community mental health. Mayor Nenshi holds a Bachelor of Commerce with distinction from the University of Calgary, and so he is an alumnus of our university, but also holds a Master in Public Policy from the John F. Kennedy School of Government at Harvard University, where he studied as a Kennedy Fellow. The mental health and addiction strategy is a key part of Mayor Nenshi's legacy, as he initiated the strategy and has championed it for the past 3 years. For example, serving as an active member of the Stewardship Committee. And as a member of that committee, I can attest to the fact that he is a very active member, not missing a meeting, and really kind of took this on and being very actively engaged. So thank you, Mayor Nenshi, for joining us today. Next slide, please. Our next panel speaker is Karen Gosby. So Karen, having been exposed to mental health and substance abuse, both in her childhood and adult life, has extensive lived experience. Ms. Gosby and her 3 children lost their husband and father, George Gosby, only 48 years of age at the time, to suicide in 2017. Since that time, she has become a highly respected advocate and community leader for mental health in Calgary and Alberta. I've had the pleasure to get to know Karen and work with her, and can speak personally to how generously she gives her time and voice to this cause. It's interesting, about 3 years ago, I remember being at an event with Karen and learning that she had just met with Mayor Nenshi with a plea to help align resources for the community and to address systemic and society failures for mental health and addiction in the city of Calgary. And the rest is history. Mayor Nenshi agreed, and in August 2018, he proposed a notice of motion to allocate $25 million over 5 to 10 years for mental health and addiction. Karen has also established the Gosby Family Foundation, a registered charitable organization that provides information, access, and referral services to anyone experiencing mental health issues. And if that's not enough, she's also the author of a best-selling book titled The Perfect Nightmare: My Glittering Marriage and How It Almost Cost Me My Life. So Karen, thank you very much for being part of the panel today. Researchers from across the university worked with the city to inform the strategy, including researchers from the O'Brien Institute and Mathison Centre, who provided input on key areas of the strategy. Furthermore, members of our university served on the stewardship group, which provided leadership to the development of the strategy, including myself, Dr. Valerie Taylor, our head of our Department of Psychiatry, Dr. David Park, HBI Director, Debbie Bruckner, Senior Director of Campus Wellness, and our other panelist, who I'll introduce now, and is Dr. Bill Galley. Dr. Galley, as you know, is University of Calgary's Vice President of Research and Professor in the Department of Medicine and Community Health Sciences. Dr. Galley was formerly the Scientific Director of the O'Brien Institute for Public Health and is a Fellow of both the Canadian Academy of Health Sciences and the Royal Society of Canada. He's also co-director of the University of Calgary World Health Organization, collaborating center in disease classifications and health information. So thank you, Dr. Galley, for joining us today. Next slide, please. To present the City of Calgary's landmark mental health addiction strategy, I'm very pleased to introduce Raynell McDonough. So Raynell is an issue strategist with the City of Calgary. She's an alumna of McGill University, but she's also an alumna of the University of Calgary's Faculty of Social Work. Since 2018, Raynell has supported the development of Calgary's mental health and addiction strategy. And having had the pleasure to work with Raynell, I can tell you that she's done a fantastic job guiding this complex process, which involves multiple stakeholders with diverse perspectives. Raynell, I will pass the mic to you now, and just take it away when you're ready. Raynell, we can now see your slides. Just let us know if you're having any difficulty with the.
I'm sorry, can you hear me now?
Yes, we can. Perfect.
Okay, I'm sorry. I was having a bit of problems with Zoom this morning. So,
okay, we're all used to that now. So yeah, so thank you. It looks like it's coming through perfectly well now.
I will start now. Thanks, Paul. So good morning, and thank you for the opportunity to speak to you today about Calgary's mental health and addiction strategy. As mentioned in my introduction, since 2018, I've had the pleasure of working with community leaders, key organizations, and community members in Calgary to support development of a mental health and addiction strategy for our community. And as an alumna of the University of Calgary and now a City of Calgary employee, I'm especially pleased to be able to foster opportunities for the city and the University of Calgary to work together in collaboration. I'm also glad to see many familiar names here today, as several of the University of Calgary's research community members have been involved in the development of this strategy. This work is important to all of us. So first, this is a community strategy. It's built on the stories and experiences of Calgarians. From the beginning of this work, it was recognized that Calgarians were struggling to find the help that they needed for mental health and addiction issues, and that a whole community cross-sector response was needed to address the situation. No one system, be it health, education, policing, social services, or the private sector, can do it alone. Mental health and addiction issues affect all of us. Whether or not we have had challenges with our own mental health or substance use, we have all lived with, worked with, or cared about someone who has. While we see the impact of mental health and addiction issues most dramatically on our streets, it's important to see these incidents as an extension of what we are all experiencing in our homes, schools, workplaces, and community. We all need help and support at various times throughout our lives. While 1 in 5 Calgarians will experience a mental health issue or prolonged illness in their lifetime, 5 in 5 Calgarians can help make life better. Throughout the development of this strategy, as we listened to and learned from the experiences of Calgarians and developed the strategy together, our central focus was to create hope and strengthen support for people, families, and communities living with mental health and addiction issues to improve quality of life. The development of this strategy began in the summer of 2018. At that time, concerns were being raised in the community about the impact of the economic downturn on mental health and substance use, increases in accidental opioid overdose deaths, the use of meth, and the complexity of mental health and addiction issues, along with poverty, homelessness, and crime and social disorder. Calgary had developed and implemented a 10-year plan to end homelessness and the Enough for All poverty reduction strategy, but there was not yet a corresponding community-wide approach to mental health and addiction. Based on these community concerns, including those of one of our panelists here today, Karen Gosby, Mayor Nenshi and several of his colleagues on City Council put forward a notice of motion that was passed in July 2018. The notice of motion directed city administration to convene a community-wide strategy on mental health and addiction that took a systems approach while keeping the person, the Calgarian, at the center. The city also earmarked $25 million to the development and implementation of the strategy to be leveraged with other sources of funding in the community. Starting in late 2018, Calgary had the opportunity to participate in the Bloomberg-Harvard City Leadership Initiative, using this mental health and addiction strategy as the focus of this program on cross-sector collaboration. Calgary's experience in this program and the impact it had on the development of Calgary's mental health and addiction strategy has been profiled in an article for the Stanford Social Innovation Review, which is linked on our webpage, and I will share that at the end of this presentation. Due to the importance of the stories and experiences of Calgarians in informing the strategy, starting in early 2019, we conducted a multi-stage community engagement process with individuals and organizations in Calgary. Also, a stewardship group provided leadership to the development of this strategy. Karen Gosby was one of the co-chairs of the stewardship group, which also included Mayor Nenshi, Dr. Bill Galley, Dr. Paul Arnold, and community leaders from the health, education, government, corporate, and not-for-profit sectors. The stewardship group also provided leadership and direction to the development of this strategy throughout the COVID-19 pandemic. While many members of the stewardship group were stretched very thin, responding to the needs of the community and their own organizations, they also recognized the importance of continuing to develop this strategy. On the one hand, the COVID-19 pandemic has resulted in increases in community needs on mental health and addiction. And on the other hand, it's also presented an increased interest and opportunity to mobilize around supporting mental health as more people have experienced vulnerabilities and changes in their own mental health and that of their families, friends, and neighbors. Our strategic framework shown here includes the key aspects of Calgary's mental health and addiction strategy. At the center is the focus on Calgarians and the vision of creating hope and strengthening support for people, families, and communities living with mental health and addiction issues to improve quality of life. This strategy is built on the experiences of Calgarians, and success will be measured on outcomes related to improving quality of life. Helping us to achieve that vision are three themes of being well, getting help, and staying safe. The framework also describes how we will work together differently and more effectively across organizations and sectors, using data coordination, coordinated service delivery, collaborative funding, evidence-informed programs and services, and evaluation and continuous improvement. The high-level results we are seeking to achieve for Calgarians are identified on the outer edge of this diagram: reduced stigma, increased knowledge, resilient people and communities, increased safety, and improved service access and navigation. Now diving a bit deeper into each of the three areas. Being well is about wellness at home, at school, at work, and in the community. This area is focused on increasing feelings of belonging and connection, preventing mental health and substance use problems before they start, and improving knowledge and coping skills needed to maintain and enhance one's own mental health and support others. Actions here include mobilizing communities in building naturally supportive environments, improving mental health literacy through both school and community settings, and mobilizing workplaces to provide positive mental health and psychological safety for employees. Getting help is about enabling Calgarians to get the help they need when, where, and how they need it. This area is focused on providing earlier access to services and supports for Calgary's youth in schools and adults in workplaces, more seamless connections between programs and services across primary care and community programs and services, and overall working towards a more efficient, reliable, and sustainable system of supports and services that improve quality of life for Calgarians experiencing mental health and addiction issues. Expected outcomes include that Calgarians are able to access the help they need for themselves and their families through workplaces, schools, and the health and community services, and to increase coordination and integration between health and social services to offer a continuum of care that is holistic, human-centered, and appropriate to the needs of the individuals and families seeking them. Thirdly, staying safe is about ensuring security for Calgarians at all times, and especially in a crisis. This area is focused on connecting Calgarians experiencing a crisis related to mental health or addiction to effective help in a timely manner through an equitable and effective crisis response system. Actions include strengthening existing crisis supports and transforming Calgary's approach to persons in crisis. Expected outcomes include improved crisis triage, 24/7 availability of non-emergency support and outreach services, increased access to community and peer support programs, and increased access to court diversion programs. Calgary's mental health and addiction strategy is not just about creating new programs and services at ever increasing cost. Several of the actions within the strategy will be achieved through leveraging and reallocating resources that are already available. However, where new, innovative, or expanded services and approaches are needed, additional funds have been made available through Calgary's Mental Health and Addiction Investment Framework. The investment framework includes three streams: Change Can't Wait, Connect the Dots, and Targeted Investment. Change Can't Wait supports innovative ideas that bring change at the individual, family, community, or policy and system levels. Funding is provided for 4 to 6 month fast pilots. A 6-member community investment table, including the Calgary Health Foundation, Hunter Family Foundation, the Calgary Foundation, the City of Calgary, United Way of Calgary and Area, and Viewpoint Foundation, have collaboratively invested in 29 fast pilots in 2020. And as of the beginning of 2021, these programs had reached over 7,500 Calgarians. And there is a current funding call now for further Change Can't Wait ideas. These fast pilots have resulted in successes and lessons learned, which can be used to scale up successful approaches and inform future investments. The second investment stream, Connect the Dots, provides enhanced support for evidence-based programs and services that respond to the mental health and addiction-related issues affecting Calgarians. And finally, the investment framework also includes targeted investments for evidence-informed projects that advance the actions of the strategy at the policy, systems, or community level. Finally, I'd like to mention that investing in the staying safe theme, particularly, includes funds through our community safety investment framework to strengthen existing crisis supports and transform Calgary's approach to persons in crisis. Too often, the only response available to a person experiencing a crisis related to mental health or addiction in Calgary is the police and the emergency department of the hospital. We have the opportunity through Calgary's mental health and addiction strategy and community safety investment framework to reallocate funds, to scale up programs that work well, and identify new approaches to crisis response and connection to the help that people need to prevent a similar crisis from happening in the future. And now we move to our transition to implementation. In the first quarter of 2021 of this year, the strategy and action plan was endorsed by Calgary's Mental Health and Addiction Stewardship Group, and it was then unanimously endorsed by Calgary's City Council. We've now moved into implementation, the first phase of which is from 2021 to 2023. The City of Calgary has taken on the role of convening this implementation process at this time. The first steps that we are taking with all of our community partners include establishing governance for shared community-wide accountability and mobilizing actions identified in the strategy. This strategy has been informed by and connected with research in many ways. And I'd like to highlight a few research projects that have been most closely involved so far or aligned with this strategy. First, the Connections First project, which is led by Dr. Suzanne Tuff, is about how to foster naturally supportive communities that result in feelings of belonging and connectedness. This research project has been completed through a Max Bell and Burns Foundation fellowship and is now being applied in the community. It has directly informed the Being Well theme of the strategy, and particularly in terms of wellness in the community. Secondly, school-based mental health Tier 2 intervention. This is work that's being led by Dr. Paul Arnold. It is in partnership with the Calgary Board of Education and the Calgary Catholic School Division to transform the system of early access to mental health and addiction services in the school setting, and that's within that Getting Help theme. The Precise MH project, or Precision Care with Information, Science, and Experience Mental Health, which is led by Dr. Dallas Seitz, has the goal to improve our understanding of the relationships between Alberta Health Services addiction and mental health, homeless shelter, and police services in Calgary through data linkage and analytics. This 5-year project can inform implementation in the staying safe area. And Karen Gosby and myself are both members of this project advisory committee. And finally, I'd like to mention the Indigenous Mental Health Project, which is being led by Dr. Jessica Shaw. This 2-year project aims to create a mental health model that's rooted in Indigenous elder worldviews, knowledge, and practice. The Elders Knowledge Circle, the United Way of Calgary and Area, and the City of Calgary are partners and collaborators on this project that has recently been successful in receiving SSHRC funding. And finally, I invite you to please visit our webpage at calgary.ca/connectthedots for more information and updates about Calgary's mental health and addiction strategy. To access the strategy and action plan itself for 2021 to 2023, or to sign up for our e-newsletter. You're also welcome to contact me directly by email or phone. Thank you very much.
Great. Thank you so much, Raynell, for that excellent presentation of the mental health and addiction strategy. I think it really sort of helps set the context for what we're about to do now, which is turn to our panel. And audience members, again, just to remind you that you should feel free to enter your questions into the Q&A box at any time during the event. So that's the question and answer rather than the chat box. The Q&A chat box at any time during the event. We'll begin the panel discussion, and we'll also look to answer some of your questions. We do have some questions that were sent ahead of time, so thank you for those of you who did that. So we'll be sort of working our way through both those questions and ones that come through today during this presentation. So I'm going to start things off with a question directed towards Mayor Nenshi. So Mayor Nenshi, mental health is often seen as being the purview of provincial and federal governments. So why is it so important, in your view, for the city of Calgary to get involved in this way and to play an active role in the mental health of its citizens?
My mute got stuck there. There we go. Happens at least once every meeting. Well, you know, somebody's got to do it. And ultimately, one of the interesting things about being in municipal government is that legally and constitutionally, we don't actually have a lot of authority. We only have the authority that is devolved to us by the province. So, you know, on a relevant note at this moment, in Alberta, cities don't have any public health authority. You know, in other provinces they do, and so people keep asking me, well, why aren't you directing the medical officer of health to do this? Well, in fact, in Alberta, we don't have that authority. But what I do have, and what cities do have, is the power of convening and bringing people together around an issue. Bluntly, Paul, if you get a note from the mayor saying, I want you to join this committee, you're probably going to say yes. And so that was really the only authority we had. And we've done this before. So cities were at the forefront of our plans on ending homelessness about 15 years ago. When I first started in this role, we created one of Canada's first community-based plans on ending poverty. And we did the same there. So here, the critical thing was to use the city's convening authority to get people who were already working in the field, but maybe not working well together and talking to one another, into the room. And we made sure that the provincial government was with us, including folks from Alberta Health Services who were invaluable to our work. But also we had an MLA, Whitney Isaac, sit on the stewardship group with us, so that there was a political link as well. And I had a lot of political links with the Office of the Associate Minister of Mental Health and Addiction. Our challenge, by the way, was that we didn't have any federal government representation. Because of course we don't have any political federal government representation in Calgary, and sometimes it's hard to get the federal government involved. Certainly in our poverty work, they were around the table as well. So one of my jobs now, in fact, just yesterday, I signed what felt like 1,742 letters to people introducing them to the strategy, including to most members of the federal cabinet, talking about the importance of the work we're doing to folks like the Minister of Public Safety and the Minister of Diversity and Inclusion, and so on. So we have to continue to do that work. But ultimately, you know, one of the best things about Canada is that no politician is ever responsible for anything, because all you have to do is pass the buck to the other orders of government all the time. You know, perhaps you've seen some of our premier's press conferences. Anyway, so ultimately somebody had to bring people in. And our idea was just to bring in the stewardship group. And the only real criteria to be on that stewardship group were you had to be smart and you had to care about the issue. And bringing together those diverse voices all in one room, encouraging people to give up their turf and just think about, as Renelle said, that systems view, that view where we're trying to put the citizen at the center of what we're doing, not our process or our bureaucracy or the way things have always been done. And so I think that was quite successful. The challenge now is to find financial support from the other orders of government. And that was one of the reasons why I did something a little bit uncommon, which is I went to the council and asked for the money first. They didn't like it much. But I said, you know, give us the 25 million, of which 10 million, we kind of knew how we were going to spend 15 million of the 25. But I said the 10 is a flyer. The 10 is going to be to sit out there. And once we have a strategy, not just put it on the shelf until we have funding for it, but at least have the seed money to start that. It's not nearly enough money. It's not nearly enough money for systemic change, but it meant that we didn't slow down. And Raynell, I think, got a few days off and then got right back to work on stewarding this work. And that was really the critical part of the work.
Great. Thank you very much, Mayor Nenshi. Yes, a quick comment. I really like your comments about the stewardship group, and I think it was very productive, and I think brought together people who wouldn't necessarily always have those kinds of conversations. Some of the research projects that Raynell was highlighting, such as the one that she mentioned that we're doing with the schools, really were a direct result of that, kind of bringing together, people together with common interests and diverse expertise. I'm going to turn to one of the questions that came up in the Q&A, and was curious for, maybe I'll turn to you, Karen, just to get your thoughts on this. And that's, what are your thoughts on how success of the Change Can't Wait projects will be measured? And if they're considered successful, how will they be supported to continue? What are your thoughts on that?
Yeah, I was just reading that, but I think the fact that they're sort of embedded into the community already, and they're being scaled up is a good indication that they're being successful. One of the ones that right from the get-go, we had organizations working together in order for people that they could find help and get appointments right away, and it was piloted and very successfully. It's Connect YYC. And I'm sorry, I forgot it for a moment there, but if they needed to find specific help within a 24, 48 hour window, which typically, how I got interested in all this was with Dr. Chris Eagle and examining the whole emergency room experience, where 77% of people are turned away from emergency. They're given an appointment 3 to 6 months. And that's a perfect example of how now they could log on to these organizations that, are basically sort of predictable, the ones that are in an emergency situation and they need help right away. They were getting directed to help, and it was so successful that they're expanding it to double the amount right away. And then there were other pilot projects as well that were very successful and that we're leveraging and we're expanding as well. And I think that in itself speaks a lot. But we do need to, do an analysis and track exactly what's going on and look at the ones that are successful and do the right evidence-based, analysis on it in order to get the results that we need, so that we're, being directed and guided, which is really why we started this whole program, is to get everybody working together and explore new ideas.
Thanks a lot, Karen. Actually, and what you just said about the evidence-based analysis is kind of a nice segue to my next question, which is directed towards Dr. Galley. Dr. Galley, what do you see as the unique opportunities presented to the U Calgary research community in the city strategy?
Thanks, Paul. So really, I want to pick up on what both the mayor and Karen have said. I was first invited to be on the stewardship group wearing the hat of my previous role, which was that of scientific director of the O'Brien Institute for Public Health, where in the Institute we were engaged in collaborations with yourself, Paul, in the Mathison Centre, with the Hotchkiss Brain Institute, but also broadly with a network of colleagues across the University of Calgary campus in a collaboration called Make Calgary. And I notice in the audience that Fiona Boulet, who is the coordinator of Make Calgary, is attending. And Make Calgary was really a partnership with the city based in the Urban Alliance, which is an explicit University of Calgary, City of Calgary partnership for many domains of scholarship that enriches the city and reciprocally enriches the university. Some of the projects are focused on water, others on transportation systems, but health has become an increased focus in recent years in Make Calgary, and the notion of healthy cities has been brought forward, and the collaborations have included our faculties of social work, kinesiology, architecture, planning and landscape, medicine, nursing, and beyond those faculties. And there has really been I would say, a health in all policies lens of thinking about health, where policies that come to us from all levels of government. The mayor was addressing this do affect our lives and affect our health. And there's no question that municipal policies affect health, whether they relate to policies around housing, affordable housing, transportation systems, leisure opportunities, how socially vulnerable populations are supported, and how the city supports social vulnerability, et cetera. And that's where my interest in the strategy was, in that health in all policies lens. And as the stewardship group met, and the beautiful work that the city did in convening so many stakeholders, I learned so much just listening to the discussions. And I thought it was particularly cogent to have representation from schools, from the school boards, where we know that a lot of child and youth mental health relates to all those hours that that children and youth spend in schools, workplaces. So a number of CEOs in the Calgary region were present with their executive teams, and the stewardship group, Curtis Stang with ATB, for example. So workplaces matter, municipal policies matter, communities matter. And then there are some bigger societal issues as well in relation to stigma and public education around matters of mental health. And there are sociocultural considerations that we're learning so much about through COVID, where we've learned that things like paid sick leave matters, and that if you're a refugee who's come to Canada, or you've immigrated and have come to Canada, there are considerations that affect your health and well-being, and mental health is a big part of that. And we've learned about how companionship is so important to mental health and well-being. And so I go back to saying to Mayor Nenshi, cities are crucial and perhaps the most important in affecting our mental health. If we go back to health in all policies, and that's not to understate what care systems do and where the work and the decision-making of Alberta Health Services and Alberta Health is of course very, very important in terms of mental health care. So we have many faculties who are engaged in Make Calgary and other initiatives who can work with this strategy and engage on advancing the health and well-being and the mental health in our community.
Thanks, Bill. I was going to pick up on something you were saying. There's a lot to unpack in what you're saying, and it really about the social determinants of health, and particularly addressing socially vulnerable populations. And interestingly, a number of the questions that have come in relate to that topic. And I was going to, turn to the mayor actually to kind of respond to a couple of them, because I think they, I think they really address that issue. And one of the first ones that came up was looking at a socially vulnerable quadrant of the city, which I know is near and dear to your heart, Mayor Nenshi. And the question was that what are we doing to specifically serve Northeast residents in Calgary in particular, given their different resources and needs, and potentially disproportionate impact of the mental health fallout of the pandemic? Maybe provide some thoughts on that, Mayor Nenshi.
I'm very happy to do that. And I'll start with my little hobby horse, which is that one of the things that we do in Calgary is we either other East Calgary or we ignore it. And in fact, the premise of the question is a bit flawed, because every part of the city has immigrants and refugees, and every part of the city has second language issues, and every part of the city has different needs and different resources. However, the second half of the question about COVID is very important and quite critical. And so we had a big debate around the table on kind of our organizing framework for how we wanted to think about the project. And I actually was pushing for a citizen-focused organizing framework that looked at things like newcomer mental health and women's mental health and elders' mental health and so on. And ultimately, we chose to move in a different direction and really look at how people are existing in the community. So that first one, being well, right, is really about being well at home, at school, in the workplace, in your faith group, in the community. And that really gives us the ability to start looking at approaching people in different ways. You know, the oldest rule of politics is you don't expect people to come to you, you go to where they are. And so the idea there is to understand that, students likely have similar concerns that are slightly different because of socioeconomic status or ethnicity or family function, but in some ways are also very similar. And so the idea really is to try and get to people in the various aspects of their life. So of course that means, to answer the question directly, that means that we have to do a lot of work with community-based organizations throughout the city, but in Northeast Calgary, a lot of agencies that work with people for whom English is a second language. But we also have to be able to approach people, for example, when they're at post-secondary, and if they're students or workers in a big city like the University of Calgary. So all of that stuff kind of plays in together in the work that we have to do. So the next steps of implementation are really to go to more direct groups. So another example I'll use is women's mental health. You know, I've been on my soapbox for some time about how one of the most misunderstood and least diagnosed mental illnesses is what we used to call postpartum depression. And how do we get to new mothers to help them understand this is common? There are ways to deal with it, especially those who had children during the pandemic, you know, bringing a child into the world in this kind of world. So there's a lot of work we need to do there as well. Now, there is one exception, and I did see there was a question on this, so I'll just jump to it, which is Indigenous people. And you will see that what we did in the study is there's a blank page in it. And the blank page is meant to symbolize that we're creating space for Indigenous-led initiatives on Indigenous mental health, many of which predate the work we did, some of which is still going on, but we really have to make sure that we have crafted the space for an Indigenous-led strategy there. There's also certainly room for strategies that are led by different groups, whether it is, for example, a strategy focused on South Asian elders who tend to have a different experience because they tend to be living in multi-generational homes. And you don't think of them as being isolated because they're surrounded by family, but there's a different kind of isolation. And so there's certainly room for a lot of this to happen within the overall framework. The framework is meant to be permissive and allowing for a lot of this to occur.
Thank you very much, Mayor Nanchi. And I think, yeah, I mean, you addressed a number of the questions which kind of got to that social vulnerability as well as specific groups, Indigenous and racialized groups, I think, as well. And a very quick plug, you mentioned about looking at the impact on pregnant women. Just there is a really ambitious and comprehensive study going on here at University of Calgary that is looking at the impact of COVID and the stress related to COVID on they're following a number of women who you know, became pregnant during the pandemic, and it's actually led out of here, but it's a national study.
Oh, that's cool.
So I think there's lots of opportunities, I think, to link that to the city strategy. I had another question. You're talking about kind of making space, and but I'm going to sort of turn this one to Karen, because there was an interesting question about, you know, and I know you sit at a number of tables, Karen, not just here at University of Calgary, but sort of you have a very provincial lens on this. And one of the questions was about, you know, are there plans to broaden this thinking to very least to surrounding communities, you know, Rocky View, Cochrane, Airdrie, et cetera? And do you have any thoughts about that?
Well, yeah, I have lots of thoughts about it. I mean, one of the things that Raynell did touch briefly about was the Harvard Bloomberg experience, and a part of that experience, which I was honored to be a part of, was the mayor had been a part of it, and he is connected to mayors across Canada. And we've had already, he hosted the mayors across Canada, and we were able to show what we've done here. And I was again honored to be a part of that panel and speak of and engage in how, as a municipality, as a mayor, how they could convene and get behind just what he had spoke to the first time you'd addressed it. But I think what's happened, and you know, getting back to just what the mayor was talking about, even when you boil it down to quadrants, or just the fact that we're having this energy and that we're starting to have these, you know, re-engineering the conversations that are going to re-engineer the system and to collaborate is really bleeding into a lot of areas. And people are starting to look at how you can look at things differently. And just think about systemically how to change things and have conversations. And when we were talking about just COVID in the sectors, I personally was so proud of this and how they all kind of got together. And in the Northeast, they seemed to be the most organized, and they were setting the example for everyone else as to how they had so many different interpreters, and they were able to get that information out, and all the agencies got together and they were able to get that information out to the community. And I think we're just leading by example is what's happening. And the COVID situation has just, it's been actually kind of a silver lining, because at first when it did happen, we thought, okay, well, we got to park this and just, deal with this pandemic. But what it did was create a sense of urgency that we actually have to get on top of this, and we have to do it in every lens that basically pertains to life, not just mental health and addiction. So I think that my dream, obviously, is the same as what the mayor had said, that he wants to come up with a city strategy and people can just adopt it, but that, that people will just learn and listen and pick up, and we will be able to get people to have these conversations and start doing these things differently just by leading from example.
Thanks, Karen. Yeah, it's really interesting what you say about that silver lining, and that sort of comes up at a number of levels about how this is really provided a sense of urgency around mental health care. Already a crisis going into, of course, the strategy was developed well, for example, was initiated well before COVID, but just created that sense of urgency, which I think has created some opportunities. Turning to you again, Dr. Galley, I didn't want to leave this panel without asking this question about the potential linkages with the campus mental health strategy. Our campus mental health strategy is certainly one that's, actually has got a lot of recognition across Canada. We have our whole large student body who are, of course, impacted by mental health, and of course, they're part of the city of Calgary. What are your thoughts about how the city's strategy could potentially advance campus mental health, particularly of students?
Yeah. So the biggest thing to say is that Debbie Bruckner, who is actually, I think, in the audience today, is the colleague at the University of Calgary who served on the stewardship committee, and who has a lot of knowledge, and in fact has been one of the lead strategists of our student wellness considerations. And then our broader university mental health strategy is something that's worth looking at. It is available on the University of Calgary website. I did want to also just indicate that because I know Michael Hart is attending today, we also have a TAPATOPE, which is our Indigenous engagement and partnership strategy, where there are considerations. Obviously, we have a proportion of our student body that is Indigenous, and we have a number of research initiatives that relate to Indigenous health and well-being, and those are obviously very pertinent to the strategy. Back though to your question about the mental health strategy and our initiatives in student wellness, I think that this strategy brings people together very effectively, and there are synergies to be had where we have the Calgary's two public school boards that were represented on the stewardship committee, where I know there is research, and Paul, you're engaged in some of this work on whole school interventions that affect mental health and well-being, not by directly addressing only the tip of the iceberg, students who need help and support, but rather social cohesion enhancing and community building interventions in educational institutions that bring a sense of belonging, and that bring social interaction, opportunities for leisure and connection that go beyond saying, I'm depressed and I need help, or I have a substance use challenge and I need help. And I think the University of Calgary is certainly keen to interact and partner with other organizations that are thinking about really the communities, and by community I'm referring to, in this case, the University of Calgary community, the community's well-being. And so in ending my answer, I'll just go back to saying Debbie Bruckner is our lead in this domain, and a person that the audience should reach out to Apologies, Debbie, for giving you a bunch of emails perhaps, but people should reach out to Debbie to hear more about the strategy.
Yeah, thanks very much. And also thank you to Debbie for all your work on the strategy, together with Andrew Zato and others who've really, I think it's really, really sort of changed the landscape here at U of C in terms of student wellness, and there's still lots more work to be done. And there was another question, and I'm going to more maybe pick up on something you were saying, Bill, and sort of answer the question or comment on it rather than turn it to one of the panelists, which was one of the questions was about, the work being done to address mental health in the schools. And just a comment that, because the comment was an interesting one, one of the participants who's saying that as a family doctor, they noticed that, kids or teenagers are hesitant to access counseling. So just a comment, what you're saying, Bill, is really absolutely true. I think that mental health promotion is extremely important in the schools and something that's emphasized in the strategy, but there's also a piece of the strategy that Raynell referred to about, really improving that access, that linkage between schools and health services. So there's that whole continuum, from all the way from promotion to intervention. I did have a question for maybe going back to Mayor Nenshi, and that was kind of just maybe kind of, this is beyond your tenure as mayor, and sort of actually beyond the actually beyond the strategy as it's currently framed. Putting your crystal ball on, what do you think on 2023? Or what do you see as the next steps for the city that they could advance on, perhaps to build on some initial gains from this strategy?
I think the really critical thing here is that this doesn't just become a report on a shelf, that it has to be something living, and it has to be making real change for people. So the question about schools is an interesting one, right? Because I saw Nishan had also written in the Q&A something about, well, the education ministry doesn't seem particularly interested in cutting edge, thoughtful things at the moment. Also true. But the real issue here is to change attitudes, is to change how we think about mental health, so that it's not a matter of kids in school being nervous to seek counseling, but it's also not just that formal counseling is the only intervention available in schools, that there may be peer support groups, that there may be opportunities for people just to talk more about how they're feeling and how they're doing. And so, my last meeting, for example, was with the library, the public library. And we have, I should have mentioned, and Raynell did mention, but this is actually really important, is that we didn't want to just spend a couple of years developing a strategy. So we have this program of fast pilots that we called Change Can't Wait. And the idea was just try things, see how they go, see if they work. If they don't work, stop, fail quickly, also succeed quickly, which, by the way, is also my point of view. I'm just trying to answer all the questions at once, which is also my point of view on this notice of motion around allowing alcohol in parks. Of course, alcohol is the most misused substance that we have, but would this make a huge difference in that way? Not sure. Is it something worth trying for a month or two and see what happens? Maybe so. And that's really been our goal. So, back to the library, one of the fast pilots is the implementation of a mental health desk at the Central Library, where people can go and get mental health assistance in a community format. And the conversation that I was having with the library was like, that's great, but why don't we have everyone who works at the library trained in mental health first aid? Why don't we have them in a situation where they can understand signs of distress? Why don't we put mental health programming into some of the programming we're doing? So back to postpartum depression, we got lots of programs for moms and babies. Why don't we insert some mental health language and have the facilitators go through mental health first aid so that they can see people who are in signs of distress? Similarly, we have lots of English as a second language programs or English language learning programs. So let's make sure that the folks who are facilitating those programs can also see signs of distress or post-traumatic disorder in recent refugees and immigrants. So it's really about embedding this stuff deeply into the work that we're doing anyway. And so in addition to having specialized work, and that's the second part, right? Be well wherever you are, get help where, when, and how you need it. And we should have, and I made a mistake, which is we should have started today by letting people know that there are tons of resources. That there's a lot available in the community now and how to navigate the system. You know, I had two things that really spurred me into doing this work. That award from the Canadian Psychological Association was some years ago, because I've been working on mental health issues for some time. But the two things that really spurred me into doing this work were, number one, the incredible addiction crisis we have and the substance misuse crisis that we have. And I'm going to spend a minute on that. But the second was because, like so many, I had someone close to me who was struggling with mental health and addiction issues, and I had so much trouble getting him the help he needed. And I thought to myself, I'm the mayor, I know everybody, and yet I'm having so much trouble. So how is anyone supposed to navigate this system? So I want to tell people right now, if you're having this conversation, if there's someone close to you who is having trouble, if you yourself are having trouble, resources are available. Call 211 right away. And the folks at 211 are amazing referral agents who know everything that's going on in the city and can help you find the help you need. But one of our fast pilots was the simplest thing, and it's so good, which is Community Connect YYC. And maybe I can ask Renelle or Nancy to put the link into the chat so everyone has it. But it is a simple website that says, if you're suffering postpartum depression, if you're an elder who is in trouble, if you need help here, here's where you can go. And those services are important and they are available. Finally, I just want to quickly address the issue of substance use, because we haven't talked much about that. This really started with a conversation around addiction and misuse and overdose. And, you know, we lose more people to overdose in Calgary than we lose to violent crime and car accidents combined. And for a while, we were saying that we lost more people to overdose than we lost to COVID this year. Sadly, in Alberta, I think the numbers are actually almost the same now. But at the same time, these are very serious concerns. And so the part about getting help where, when, and how you need it, and the part about staying safe are really important pieces of the work we're doing. And that is a broad approach. The provincial government is very focused on the concept of what they call recovery, but our approach is broader than that, ranging from harm reduction to prevention, or I should start with prevention, from prevention through harm reduction, through enforcement to recovery and treatment. And all of that, I think, plays an important role in the work we're doing. So we only got a few minutes left, so I will stop there.
Thank you very much, Mayor Nancy. I wondered if Karen had a quick follow-up on that. The issue of getting help. I know that's obviously something that also drove you, based on your own personal experience, to become involved in this work.
Yeah, and I mean, I echo everything. Obviously, the mayor, he's so eloquent in how he says and delivers things. I always hate talking after him, but but I want to say that I came forward because I wanted to raise awareness, educate, advocate, and I found it so difficult. We knew what my late husband George Gosby needed with regards to addiction, and had no idea how the family can access it. It was really impacting the family. But one of the questions that was presented to me just this week was, you know, we know the system's broken or it's designed the way, and we're trying to re-engineer it, like I just said. But it just became aware to me that all of this conversation that we're having, we're trying to sort of reduce the shame and stigma. But I think we have to start addressing the fact that there are some myths out there that people do need to know. And it's just, the big ones like, this won't happen to me. And if it does happen to me, I can deal with it privately. Nobody needs to know. Or the system's got me, it's there. And that was the big thing I got stuck on, because I knew there were a lot of resources. I didn't know how to access them. And I think the last one is that there's this miraculous a way we can solve addiction. And I think people just need to be educated and aware of the realities of what mental health and addiction is. And this is really just sort of amplifying everything, the reality of the situation and all the resources out there. And it's getting us all talking together. So it's great. I'm so happy to be a part of it. And thank you. And the partnership that we have with U of C, backing up, getting all these evidence-based, it couldn't be a better partnership.
Well, thank you so much. And that's actually a great positive note to end on. And I would also say that, the feeling is mutual, that certainly the partnership that we've had from the university, I think, is being really, really exciting. and really looking forward to moving forward and in partnership on the strategy. So again, thank you to all of the speakers, panelists. Thank you also to Ronel for that great presentation. Thanks to Mayor Nenshi, Karen, and Dr. Galley for such an engaging discussion, and really for sharing and being open with your thoughts and views about how we can and will build a stronger city to recognize, acknowledge, help treat, and support people experiencing issues related to mental health and addiction. I think that's sort of what it's all about with regards to the strategy. And I'd also like to thank the audience members for joining us today. So I'm sorry that we didn't get to all of those questions, and I think speaks to the importance of this issue, that there were many, many questions that came through the Q&A, but hopefully that you were able to get many of those questions answered. The event has been recorded and will be posted on the O'Brien Institute website to be viewed afterwards. So I think I will end there. A quick shout out to Josephine, Ada, and Brittany, and Liz for their help, and have a great rest of the afternoon, everyone.
Thanks, everybody.
Thank you.